Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here, and today I want to talk about a very interesting cause of pain with golf. Now, it's quite common for me to get questions like, I've got some hip pain when I golf or some back pain, what should I do? And it's like, well, there's no like one size fits all. We have to do a thorough evaluation. We have to figure out what is causing the pain. Is it a movement? Is it overuse? Is it a muscle thing? Is it a joint thing? So let me just talk about some typical patterns to give some ideas. So a very common thing you see with the aging population is hip arthritis. With any kind of arthritis, well, particularly the shoulders and hips, usually the first thing to go away is hip internal rotation. So picture your femur pivoting inward in the socket. That's hip internal rotation. Happens to be a very important motion for a lot of sports, probably all the sports, but particularly golf because there's so much rotation. So if you're missing that, you're just pushing past your physiologic barrier, which can irritate that joint, and then you tend to get more motion at the next joint. In this case, maybe it's your spine, and that can irritate the structures as well. Another typical presentation is stiff hip flexors. Stiff hip flexors is like epidemic levels, mostly because we are a society that sits a lot, and you get some adaptive shortening of the hip flexor. That muscle attaches to all your lumbar vertebrae, so when you go to stand up, it kind of yanks those vertebrae forward. If you have any weakness of the muscles attached to the spine, then that can create a little too much shear at the spine and cause irritation. Another typical pattern is just weakness of the paraspinal muscles. Those are ones that kind of stabilize, well, not kind of, they definitely stabilize the spine. And we know this from countless studies that when there is weakness, or what they call fatty infiltrates in the multifidi, the paraspinal muscles, that is highly associated with back pain. That's an extremely common finding, and that's from probably decades of healthcare practitioners telling people to not lift with their backs. Everyone thinks their backs are fragile. And then they develop weakness in the backs, and then they go to lift something that's a little too heavy for them at that moment, and then you get irritation. So super common. Getting the back strong is vital. Another thing I've seen a fair amount of is missing rotation in the hip or missing ankle mobility. And as a compensation, you kind of get this hip sway, I think is what golfers call it, where the hip kind of juts out to one side. That can cause a lot of irritation and even cause bursitis of the hip. So those are probably the most common ones I see. There's probably way more than that, but this is just off the top of my head. I did see one golfer today. This is a little bit of a side note, just interesting as well. And he had a hernia, and he had a hernia repair, and now he's trying to get back to golf. And what we discovered today is that when he swings, he kind of holds his breath, and that caused a little irritation at where his hernia repair was. So I think, well, I'm not sure, but my theory is that because he's holding his breath, it causes an increase in abdominal pressure, something that a lot of people do. And then maybe that created the hernia in the first place. That's a really common thing because you can stabilize your spine in a couple different ways. And people tend to do the easiest thing, it's subconscious. So if the muscles that attach the spine are a little bit on the weaker side, then you can create a sort of corset of pressure around your spine just by holding your breath. And it's not that that's necessarily bad. I mean, it'll definitely raises your blood pressure, but it's bad if it creates a problem. You know, it's a strategy, it's a workaround for people, and it's not always a problem, but it's something to be aware of. All right, so let's get into this interesting case I saw. So a gentleman comes in to see me, and he's got some right-sided hip pain that occurs with golf. It's been going on for a few months now. He had the hip replacement on the other side, so the first thought is, okay, maybe there's some compensation, and that word compensation gets thrown around a lot. Doesn't really mean a whole lot to therapists, but maybe he's putting more weight on his right leg. I evaluated his back, tested his reflex, and something called myotomes. No evidence of irritation coming from the back. Tested the nerve, because you can have neural tension that can create this kind of issue. look at some of the things I talked about earlier in the podcast, like his hip rotation, definitely missing hip rotation, both sides, more so on the hip implant side. Definitely stiff hip flexors, but when you put them in a hip flexor stretch, maybe create a little bit of irritation. So, we gave him some of the exercises there for all that low-hanging fruit, hip flexor stretching and some back strengthening, and he also tested, a little bit on the weaker side for strength in the hip abductors where some of the pain was being generated. Gave him some stuff to strengthen that. And, I've only been seeing him for maybe, I think it's our third session today. Comes in today, he's like, things are getting marginally better, nothing huge. Excuse me, that was 2 visits ago. So on that visit, I'm not expecting a massive change that quick, but I was like, okay, let's just look at everything. So then I looked at his swing, and the first thing I noticed is his back leg, his right-hand golfer, doesn't come up at all when he is in his fall-through. The heel's supposed to rise a bit. Instead, he's kind of planted in his feet. So I had him do the swing multiple times, and I did it really slow, and I said, tell me when you feel it. And it was right as he's following through and that foot is planted where the heel should be coming up, that's when he was starting to experience the pain. So the only thing I told him that day was, well, first I asked, why do you not lift your heel up? He's like, I don't know. I've been doing that for 30 years. So I thought, okay, maybe it's just a skill issue or a technique issue. So I said, okay, next time you golf, just really focus on it. Try to get that heel up a little bit. So he comes in today, and I said, okay. He's like, that was hugely helpful. I had to really focus on it, but when I lifted my heel up, I didn't feel the pain. So then we did a little more digging. I said, well, why do you think it is that you don't lift your heel up? So you have the ability to. You have the range of motion. I rechecked everything. He had adequate range of motion to do it. He's like, I'm not really sure. So I was like, well, do you think there's a balance issue? He's like, actually, I do sometimes feel like when I rotate through, I'm going to just fall over. So, all right, we checked his balance. Put him on foam, eyes closed, did all of your typical balance assessments, got him on single leg, which is hard for a lot of people. And he was able to stand on a single leg pretty darn good, like 20, 30 seconds on each leg with no problem. So we took it a step further. I said, okay, stay on one leg and now rotate your body. Let's see what happens there. Boom. He almost fell. Right? I had to catch him. I said, what's going on there? He's like, I don't know. Sometimes when I rotate, I just get off balance. I said, whoa, okay, have you ever had vertigo? Yes, I did. I've had 2 instances of BPPV. That's if you've heard of the problem with the crystals getting knocked loose in the inner ear causing severe dizziness, that's what that stands for, benign paroxysmal positional vertigo. And I just know from years of treating that tends to have sort of 2 components, especially when it's happening more than once. You've got the inner ear problem, the crystals problem, but then you can develop something called a vestibular hypofunction, which is kind of a miscalibration of the visual ocular reflex. And that will usually occur because when you've got that crystal problem, turning your head is frightening because you might vomit and it's really severe. So you tend to not move your head very much, and that reflex sort of declines, just like a muscle would atrophy. So this reflex, not to get too much in the weeds, but you have it on both sides of your head, and when it gets miscalibrated, it's kind of like having a boat with 2 engines. One's 50 horsepower, one's 150 horsepower, and cause you to veer to one side. So then I put him into something called the Fuketa step test. Now, this is not the most accurate test in the world, but it's really fun. It's a great party trick, by the way, especially if people have had some alcohol, because that test is very positive in that scenario. But it's easy to do. All you do is have them close their eyes, stand in place, and then march in place 100 steps. And you don't give me any visual cues and just see what happens. And sure enough, about 50 steps in, I had to stop him because he had done almost a full circle. It was about maybe 180 degrees turned to the right it was. And he opened his eyes like, what? Facing the completely opposite direction. So do this test to your buddy and film it too, because it's hilarious. But like I said, you can get a lot of false positives with this test. It's just a clue, just like posture could be a clue of somewhere else to look deeper. So I took him into my office, and then I did a test for saccades, or saccades, some people call it. This tests the reflex specifically. You basically have to look at something and follow it as I move it back and forth with just your eyes. And your eyes are supposed to have this smooth pursuit, the smooth tracking of whatever object you're looking at. That's the function of the VOR, the vestibular ocular reflex. And when I moved the object to the right, I saw this saccade. So if you've ever watched somebody like if you're in a car with somebody and you're looking at them and they're looking at the window behind you and watching the trees go by, you can kind of see their eyes twitch, nystagmus we call it. That's basically what a saccade looks like. As I was moving the object, the eyes jumped in one specific spot. That's a pretty decent sign that there is evidence of this vestibular hypofunction. So, to bring us all into picture, into perspective, what I think is going on, now this is theory, and that's what the physical therapy is. It's hypothesis testing. You test something, you treat it accordingly, and then you retest. And nothing's changed, you course correct. So that's what physical therapy is. Anyways, I think what's going on is he felt uncomfortable lifting one foot up, particularly with turning, because of this hypofunction, which is a result or residual of multiple instances of vertigo issues. So because of that, he stays planted, and when he plants, he creates a lot of torque at the hip, and he's kind of just yanking on that glute medius on both ends, and that's creating the irritation. Because when we have him lift the foot in a slow, controlled way, pain goes away. So this is the first time in my career I'm trying to solve a golf issue by giving them a vestibular exercise, which is pretty easy. You just, it's kind of hard to explain on a podcast, but picture you're seated and you're fixating on an object on the wall, and you're shaking your head back and forth while fixating on the object. That is an easy way to recalibrate that reflex. Now, there's a lot of ways to progress that, but that's where you start. So I think that a little vestibular training plus some skill training, getting him to break the habit of keeping his feet planted, will solve this pain issue he's dealing with. And this is why it's so vital to get to root cause. Now, root cause is kind of a buzzword. I see it on a lot of people's web pages. I think it gets kind of lost in the shuffle in terms of meaning, but this is what I mean when I say root cause. Because I could treat the hip all day, and he'd probably get better for a small amount of time. Or if he just stopped golfing, it would probably go away. But then it would just come back, and you've never really solved the issue that's underlying everything. Finding the root cause is sort of the ethos of physical therapy. Also is the ethos of functional medicine. That's why I was drawn to functional medicine in the first place. Because so much of conventional treatment is just symptom-based. Take this pill to treat whatever symptom. And if you're not asking, well, why is that symptom occurring in the first place, you're missing the boat. So now that we have sort of two sides of dynamic, which is functional medicine and performance physical therapy, that combination is really powerful. And we've put together programs that are a combination of both, where we do an evaluation of both functional medicine and physical therapy to really drill down to root cause. And there's so much overlap between the two. So if this sounds like something that might be a good fit for you, schedule a consult call with us. We'll kind of help you quarterback your health and get you the care that you actually need. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.